Did you know that 1 to 6% of Americans have been diagnosed with ADHD? Those who have ADHD are not treated with therapy as a sole healing process, but are encouraged to treat their condition with stimulant medication. People who are taking these medications feel that they have no other choice to help their condition. My research question is, should people who are diagnosed with ADHD be medicated? My thesis is, those who have ADHD who do not have any other physical disabilities should not be medicated, but should be given alternate psychological methods to help cope with their disability. Due to doctors over prescribing and medicating patients, there is a concern of ADHD patients becoming addicted to street drugs to help cope with their condition. Also, it is found that ADHD medications are becoming common as a drug used for non-medical use. In my references, I have found evidentiary material that shows the difference between medicated and non-medicated individuals. The documents also provide information establishing the efficacy of ADHD medications. In the journal Diagnostic Issues for Adulthood ADHD by Jeanette Winterstein, this article provides information on the hidden cause of ADHD within adults. Her research explained that children who suffered from ADHD and had never been diagnosed became adults who exemplified psychiatric behavior. This study is a complete diagnostic of individual case studies obtained at Mount Sinai Hospital. This article is directly related to my topic question, and it will provide clear, non-biased data showing the direct cause of ADHD and differentiate ADHD from other psychiatric disorders. Another reference used and that I found helpful was Russell A. Barkley, PhD, with Christine M. Benton. Russell A. Barkley and Christine M. Benton have collaborated to create a scientific guide for adults living with ADHD. What they have done is, through various research and input from individual cases, they've strategically created tools and techniques for people living with this condition. With the information given, they will help people to live a healthy and normal lifestyle without medical use. The authors are highly informative with real-life examples on people dealing with this disorder. The article breaks down the causes and effects of different medicines and how to have successful relationships, how to deal with stress, and many others. Another source used is Everson Dan Exlius Lisa. This is a study where they develop a scientific display of 6 years of close research into adults living with ADHD. In this article, half of the subjects that were studied were medicated with stimulants, and the other half were not medicated at all. Others started medication but stopped after 6 months. This research is discussed the effects and lifestyle of those living with ADHD and how they are able to cope with life. It paints an exclusive look into how medication can affect people's lives positively or negatively. I will use this article for the cause of displaying facts of actual scientific proof. The evidence will show the difference between medicated and non-medicated individuals. Also, if the medications are actually working, and if so, to what extent. I will have the ability to draw a conclusion with scientific fact as my reasoning. I will conclude with the best possible answer to the question, should people who are diagnosed with ADHD be medicated? A strong source that was found was Jeffrey J. Wilson. He conducted a study and have exposed the reality of substance abuse among ADHD patients. After his studying the progression of individuals with the disorder, he became aware of the side effects of drug abuse in patients. MD Wilson discusses the possibilities of treating substance abuse with actual ADHD medication. He reveals the danger of ADHD medication as well as the benefits. With his findings, he argues that the treatment of individuals can be determined better with the result if the use of stimulants were closely monitored. I will use this article for the purpose of revealing some of the negative effects of taking prescription medications for ADHD. The idea of substance abuse being linked to ADHD can help determine if medications are needed to treat individuals. This is very valuable information for the answer to the question, should people who are diagnosed with ADHD be medicated? This article is directly related to the topic question, and it helps to examine the facts that I need to display. The next reference is a collaborative of authors Updaya Amshanu, Krutil Larry, Deborah Diaz, Todd Durrell, Brunt Van, David Novak, and Scott P. This article reveals the reality that ADHD medications are being used by non-prescribed individuals. The college demographic is the area that was covered, that had high use of ADHD medications for non-medical use. The authors were able to conduct a study of college students using the medication and its side effects. These doctors explained why college kids are using the drug and how the study could help understand the effects of ADHD medication. When understanding the side effects of the medicine, it helps with providing treatment on an individual basis. They provide clear reasons for its use and the difference before treating the problem and using an ordinary street drug. I will use this article for the purpose of revealing possible discrepancies within ADHD medications. This will help my audience decide if the ADHD medications are helpful or are they to be compared to basic street drugs. The information revealed will help to determine how the medication is useful. I lastly will use this information to help determine if ADHD medication is helpful for more than ADHD patients, but also ordinary people who may be suffering from stress, lack of motivation, or sleep. The PhD article provided information on the hidden ADHD within adults. This will help me to explain my point and to conduct research that is profitable and also questionable. Thank you.